Hi everyone, welcome to Arogya Physiotips. If you have not subscribed to our channel, don't forget to subscribe it and don't forget to ring the bell. Today we are with Dr. Madhuri, who is a consultant at Magnus Diagnostics. She also sits in Apollo and she is here to actually help us, or rather graduate us with a lot of points about COVID as well as vaccine. Dr. Madhuri, we welcome you.
Hello, Mrs. Pooja. It's nice to be here. So, Magnus is a diagnostic center with a difference. We not only cater to the laboratory services, the X-ray or the radiology department, and the scanning department. We do have a good setup for cardiology, that is ECG, echo, and TMT. And with this we also have a lot of specialists coming in for consultation, whether it is direct or teleconsultation services, along with a very good team of physiotherapists, our own Mrs. Pooja with Arogya Clinic and a dental clinic to add on to our advantage. And I'm really proud to say that Magnus was able to provide the healthcare services through this pandemic continuously without closing even for a day, because of the tremendous work and support of our staff.
Yes.
So I'm really thankful to them. So, any questions?
So everybody have already spoken about do's and don'ts of COVID, but how to actually cope with COVID, ma'am?
So we have been seeing a lot of patients with COVID, post-COVID. Now coming to the question of coping with COVID or the pandemic, I have few simple suggestions, what I can think of. First, don't let go of your daily routine. Stick to your daily routine. Sleep on time, wake up on time, eat healthy food, yes, homemade food, and see to it you do simple exercises, stretching, breathing exercise, or please watch our own Pooja Madam's
actually we have
videos.
made how to increase lung capacity.
Yes.
So that would
simple ones which you can sit at home, and I think everyone, each and every one of us can do for 15 to 30 minutes. That's all you need to do, and de-stress yourself. And don't tell me that you can't go for a walk. Fine, घर पे करो आप जो कर सकते हैं 15 मिनट. It will help you out. Next, you can think about, please reduce your screen time. All of us are on the gadget, mobile, laptop. वो दोनों नहीं तो we are on the TV. So
working from home,
all the time on screen. Please reduce your screen time. See to it. We are talking about physical distancing. I think people have mistaken it for social distancing. You should not do social distancing. I wouldn't say that. Pick up the phone, call up your friends and family. You need to do that. You need to communicate. You need to keep your social life active. And try to avoid all the negative newses or media or whatever we see it on the television. If it stresses you, please avoid that.
Okay.
I think this is a simple way of coping, and we know this is a pandemic and we all are praying it ends soon, but it may go on for some time, so we need to do this on a regular basis.
Ma'am, post-COVID, if you're already a COVID patient and you then turn negative and all that, when should a person start to get back into their normal routine, or when should they start doing little bit of exercises? Immediately or after some time?
So when individuals get COVID, most of them are asymptomatic or mildly asymptomatic. We say they are having very few symptoms. When they are in home isolation or even in COVID care centers, the advice given to them is do simple walking in the room itself, even though you are in the isolation, or do breathing exercise. This is when you have a COVID. So as you really asked, post-COVID, you need to continue to do the routine exercises. You need to get back to your physical activity, but not like push everything to extreme. Take one step at a time. Start slow.
So maybe start with basic pranayama, basic breathing, chest opening exercises since lungs is affected. and then go on to doing the legs
Doing the other things.
Yes.
Because I have patients coming in, can I go for swimming? I say, take it slow. You're just out of COVID. Do a simple, like how Pooja has suggested, do breathing exercise, build your lung capacity first. Then you go to doing a walk, maybe a brisk walk, and then later to swimming.
Okay.
Don't do everything at once. Your home quarantine is done of 14 days and 15th day I don't want you to run a marathon. Take it slow.
Okay. Now there are so many questions which are coming about vaccine, ma'am. Whether we should take it at all, if taken, who should not take it, and whether children require COVID vaccine or how many dosage are there, whether we should stop wearing masks. So can you clear all the doubts about the vaccine?
I think we are the lucky ones in India. So the vaccine has been released. Currently it has been allotted to the healthcare workers and gradually it will be open to the general public. As of now, the ICMR has laid down clear guidelines wherein individuals above 18 years are eligible for the vaccine.
Okay.
And it's not applicable for a pregnant lady or a lactating mother or a feeding mother, what we say, because the trials have not been done on a pregnant or a lactating mother, and same for the kids.
Okay.
So the data is still not in. So right now the suggestion is for 18 and above. And the dosage are 2 doses at 4 weeks apart, and it is given intramuscular. And post taking the vaccine, yes, you may have some flu-like symptoms, but we have not seen adverse reactions as of now reported, and it is safe. So if you are getting a vaccine, you are getting the allotted, please do take it. That's my advice. And coming to whether you can go to a life before pandemic
without mask?
Without mask? No, that is not the one. Even if you take a vaccine, even if you take 2 doses of your shots, once you develop immunity takes around 45 days minimum.
Okay.
So it's almost, we are talking about 1.5 months for you to develop the immunity. So once you develop immunity, yes, you are protected, but you can still carry the virus home, or you can transmit to others because you will be the carrier.
Okay.
You may not get the disease, but you will be the carrier. So to avoid
asymptomatic one.
Yes. So to protect your family, to protect your workplace, you need to wear mask, you need to maintain physical distancing even after vaccination.
Okay, so when will ever this physical distancing get over? We don't know, because for that COVID has to go.
The WHO says that till even a single person is left unvaccinated, the risk of the virus still persists, and with the virus changing, new strains coming, so it will take some time. So we need to hang on. Need to hang on.
So we should not be afraid of vaccination.
No.
And anybody above 18 should take it, and no pregnancy, no lactating mother. How about old people, 60 above, 70 above, are they?
They are eligible. In fact, the next lot after the healthcare workers will be the senior citizen or the elderly, because they are the high risk category. They will be given, and post that it will be individuals with comorbidities. When we say comorbidities, it means individuals with diabetes, hypertension, cancer. So that can be in any age, doesn't mean only the elderly. So they are all high risk. So they are all supposed to take the vaccine until and unless advised by their doctors.
Okay. And all these reports which are coming that something happened post vaccination, and this one, that one, they are all kind of
So I think we are 2 or 3 days since the vaccine has started, and till now there has not been a single documented report of adverse, very serious reactions. Even if there are, they are very minute, and most of them have been because of the fears. Because the people were little scared.
They had anxiety.
Like that.
Yeah,
So-
I know that because my father also vaccinated 50 people yesterday in Sharda, and he said that even there was this dentist who was very allergic, but nothing happened to him as well. So he's all fine and stuff. So yes, vaccination is safe, and you guys should take it, and you should not be apprehensive, nor you should have anxiety about it. You should take it with a smile and know that our fight with COVID exists and we need to wear mask. And we are really thankful to Dr. Madhuri. Dr. Madhuri consults in Magnus Diagnostic. So if you are around Banargata Road or JP Nagar or south of Bangalore, you can always come here. She's available from morning 9 till 2 o'clock. Please don't hesitate and don't keep your doubts to yourself. You can actually come and visit her. Thank you so much, Dr. Madhuri. And we are thanks to Magnus Diagnostic, so that they brought Dr. Madhuri to us.
Thank you.
Thank you. Do subscribe to our channel, Arogya Physiotips, and don't forget to ring the bell and keep your feedback coming. Thank you so much.